We're going to go over how to determine if you have a herniated disc. My name is Dr. Eric Broadworth. I am a doctor of physical therapy at Fuel Health and Wellness, and I do have a herniated disc. This is something I help treat all the time, but I want to help teach you how to determine if what you're dealing with is a herniated disc. So here are some pretty common signs and symptoms of that. One really common sign is you go to bend forward, right? And this is what I've got right now. Like I can go to like here. And see my knee starts to bend. My herniated disc is on this side, it's on my right side. My knee starts to bend. I really can't bend past there. You might start to get issues down the leg. That's very common because with a herniated disc, if it's pinching on the nerve, it can cause numbness and tingling down the leg, shooting pain, radiating pain, and a lot of times it's gonna go right down that leg. It might start and go into the butt, but for me, with my issue, I've got numbness and tingling into my big toe. That's a very big sign of a pretty big issue. A lot of times I will tell you with a herniated disc is that it will get better with time. Most people, 90% will improve with conservative care such as physical therapy. So you don't necessarily need surgery, but these are all signs that you really need to get it looked at and get it taken care of appropriately. The next sign, other than bending forward, would be if you were to sit like this. Sitting, for one, usually can be awful for people with a herniated disc because especially as we slouch, we're putting pressure on that disc and it might be pushing into the nerve. But if you look here, this is my non-affected side, my good side, the left. I can kick. It's a little tight, but pretty straight out. If your herniated disc is really bad, even if you kick the left, the good side, you might feel it down the affected side. On my other side, if you look and that's better than it's been in the past, but pretty limited there compared to there. And then if I do this, and then I point my toes up towards me and tuck my chin, you might feel that all the way down the leg. That's signs right there that, hey, that nerve is pretty tight and affected and you might be getting pinched on. The last sign that I'm going to show you is if you were to lay on your back like so, okay, and we do what's called a straight leg raise. So on my good side, I can lift all the way up. You should be able to get like 70 degrees. And if anything, you just feel some tightness in the back of the hamstring, that's normal, okay? That's my affected side right now. I've got about, 45 degrees. That's because, again, that nerve is being impinged on by the disc that's bulging out. So good side should just feel it here. Herniated disc, you might feel it down into the calf. You might feel it, in your back as well. Those are all signs right there that you are possibly dealing with a herniated disc. First steps for herniated disc, go see a healthcare professional. I highly recommend seeing a physical therapist. And then, if physical therapy doesn't improve, then possibly looking at an MRI. But you really don't need imaging right away. Go see a healthcare provider, especially physical therapist, someone that's trained in treating these injuries. 90% of them get better with conservative care.